Good afternoon, I'm Captain Allen. I will be teaching over the next couple of hours a course on the cardiovascular system. I will be covering basic anatomy and physiology, the circulatory system. When I say that, I'm talking about the blood flow through the heart, basic assessment, head-to-toe assessment. And this is really a visual assessment as far as things that you're going to see, and then when you're listening to the heart sounds, things that you will hear. Okay, diagnostic test for the cardiovascular system, things that are common that you'll see. We'll touch on drug therapies. We don't really have time to go into details on those, but we'll cover those in detail in another course. Surgical interventions for those who are having difficulties with flow through the coronary arteries, and then rhythm identification and use of defibrillator. Due to changes in time and training availability, then you're not going to actually have the hands-on with the defibrillator, but what we're going to do next drill is we're going to go into rhythm identification in a little bit more detail, and then you also have hands-on with the defibrillator. I'm giving you a class to nobody. That's okay. I'm just going to go on, and you guys can go on.
I was looking for one about this. Yeah.
Okay.
That was weird. That's normal. That's normal.
And we're recording this. Okay, learning objectives for the class are to be able to identify the 3 layers of the heart, know what the pericardium is, and then identify 2 significant events that occur, especially in trauma patients, okay? And then you'll have to identify the blood flow through the heart, and this starts with the vena cava, and then you're going through the atriums, all the different valves, the ventricles, the pulmonary veins, arteries, and all the way back to the aorta, so it's going to cover everything. You also have to identify the 4 heart valves and the purpose of each one. Identify the differences between veins and arteries, and then describe the pacemaker of the heart and where it is located. And you also have to briefly describe preload, afterload, and then cardiac contraction. We're going to go over on assessment. You're going to go over several different things to identify head to toe on a visual assessment on a patient, but I'm going to have you, for testing purposes, is to list 5 of these. So the learning objective would be able to list 5 key things visually that you would see when a patient walks in that you would identify as possible cardiac issues. Then you'll have to describe S1, S2, S3, S4 heart sounds. Tell me what a murmur is. And then another learning objective is to be able to describe what the P wave and the QRS complex is and what it represents. You know, what's going on in the heart whenever you see people walking by looking at me teaching a class to nobody. So, you know, what does that represent? And then you'll also have to list the top 3 anti-anginal drugs, and you know, each one that's used, what it's used for, and what its main function is, its main effect on the body. And then list 4 main cardiac drug therapies and their effect on the heart. We're not going into specific drugs. We'll give examples of specific drugs, but really it's the category that the drug falls under and effects on the heart. When you take the test, you'll be expected to pass it with at least 80%, or of course you'll have an opportunity to do a little bit of retraining and take the test again. Okay, with that, we're going to go on to the actual class, and the first thing we're going to cover is anatomy and physiology. With the anatomy and physiology, first of all, we're talking about the 3 layers of the heart. Once again, this is a basic cardiac class, okay? So we're not going to go into too much detail. The first layer of the heart is the epicardium. This is a fibrous layer. It's a protective layer, okay? Attached to the underneath side of the epicardium is the pericardium, and this is what we refer to as the pericardial sac. It has 2 layers with a space in between, and then there's fluid in that space, okay? Why this is important to you is because, especially with your trauma patients or downrange with your IED patients, then fluid can build up in the sac and have negative consequences. The next slide, we'll talk about the pericardial sac in a little bit more detail. Next, we have the myocardial muscle. That's the biggest layer of the heart, and of course, it's the muscle, so it provides the contraction, the actual force for forcing the blood, your cardiac output, forcing the blood out of the heart. And then the inner layer is the endocardium. It plays a role also in myocardial function, and infarcts into this layer can cause arrhythmias. Okay? So there's three layers, the epicardium, the myocardium, and the endocardium. So now we're going to talk about the pericardium, the pericardial sac, and a couple of situations that your patient may be experiencing. The first one is pericardial effusion. So this is just additional fluid in the sac. The additional fluid, I'm going to go ahead and shut this door. Okay, the additional fluid can just be like edema, natural fluid, serious fluid from the body that builds up in there, or it can be blood. It doesn't matter what the fluid is, basically for pericardial effusion purposes, but it's fluid buildup in that sac. So what can happen when you have excessive buildup in the sac? Well, then pressure, forces inward towards the heart. And then when you have so much pressure forcing against the heart, now what we have is pericardial tamponade, okay? So just imagine, so let's say you have, a big balloon, and the big balloon has water in it, right? So you squish the water out, and then as you release, then it refills with water, okay? Now, that's basically what your heart is doing. It's the ventricles. They're contracting, they're squishing the blood out, and then as they relax, well then it's filling with blood. So if you have pressure that's pushing against one or two of the ventricles, when they squish, when they contract, well then when they relax, they can't relax all the way and they can't refill all the way. So if you're not refilling the ventricles all the way, guess what? You have less blood volume, cardiac output, when the ventricles actually contract. Okay, see what you mean? So it decreases your cardiac output, which compromises your patient even further. So that's why that's so, and this can be, it can be fatal if it's not corrected. So definitely, you want to know what pericardial infusion is, and then you want to know what tamponade is. So when your patients are diagnosed with either one of these, then, you know what's going on. You have basic knowledge. So any questions on cardial effusion and cardial tamponade? And then in a later class, when we focus just on these two diagnoses, then we'll go into like signs and symptoms. Right now this class is so short we don't have time to cover everything. Okay, so any questions on pericardial effusion and pericardial tamponade? Perfect. So now we're going to talk about like the heart chambers, the veins, some common terminology that can be a little bit confusing. We're going to talk about the electrical system. So let's start with the heart. People talk about, especially when you're listening to heart sounds, they talk about the base of the heart and the apex of the heart. Okay? So think about a mountain. Okay? So you have a mountain right here. Okay? Everybody refers to this as the base. Right? This is the widest point. Everybody refers to this as the peak. Okay? So we have the base, we have the peak. Okay? Now just kind of flip that almost upside down, kind of at an angle. So right here, this is how our heart is, kind of shaped like a heart. We have our atrium, we have our ventricles, okay? This is the widest point. So this right here is the base, okay? And then this right here is the apex, the peak, okay? So you're just thinking about this right here is the apex. So when you're listening to your heart sounds and it says listen at the apex, you know that the apex is going to be on the left side, usually right underneath the nipple, just right there. Oh, you can see me on the video. Okay. So, and then the base is going to be up here. All right. Base and apex. And just remember also, this is the right side because you're looking at your patient, and this is the left side. now we're going to go into the mechanics of the heart. We're going to talk about the heart chambers, the veins, the arteries. Okay, with our heart chamber, first of all, we have atrium, which are smaller, and they're on top at the base. Okay, and then we have our ventricles. So this right here is the right atrium, and this right here is the left atrium. Okay, when we have blood flow going into the heart, it enters, you have veins going towards the heart. Okay, well, let's get a different color. Let's get blue for veins. Okay, we have veins going toward the heart, and the largest vein, and it's the vein, the last vein right before it enters the right atrium, is going to be the superior vena cava, okay, and that enters the right atrium, right there, okay. So we have the, you have the superior vena cava, which is the largest vein, okay. So this is carrying, veins carry deoxygenated blood. Mostly they contain carbon dioxide, CO2. It goes into the right atrium. Then we have a valve. The blood's going to go through our first valve, and that is the tricuspid. So what I want you to remember is that the tricuspid valve, just remember that the blood is trying to get oxygenated. Okay, tricuspid. Blood is trying to get oxygenated. So blood goes from the superior vena cava into the right atrium, through the tricuspid valve, and then it goes into the right ventricle. So then from the ventricle, it's going to go to the arteries. Oh, I'm sorry, it's going to go through the pulmonary. I'm distracted because people keep walking by the window and looking at me and laughing. Okay, so I'm going to start all over. Okay, so superior vena cava, the largest vein, deoxygenated blood goes into the right atrium. It goes through the tricuspid valve. It goes into the right ventricle, and then it's going to go through the pulmonary valve, because now we're going to the lungs because we want to get rid of the carbon dioxide and we want to pick up oxygen. Okay, so then it's going to go through, that'll represent the pulmonary valve. Okay, then we have the pulmonary artery. Okay, blood's going to flow there. It's going to go to the lungs. It's going to have the gas exchange, get rid of the CO2, carbon dioxide, and picking up the oxygen. Okay, so now what it's going to do, it's going to go into the pulmonary vein, because the vein goes to the heart. It's going to go into the left atrium, and it's going to go through the bicuspid or mitral valve into the left ventricle. Then from the left ventricle, we are going to go through the aortic valve. And once again, this is going to represent the aortic valve. And then it's going to go out through the aorta. Okay? And the aorta is the largest artery in the body. So with the aorta, we have ascending, goes up. Actually, it goes all the way over, the aortic arch. And then we have the descending, and then down here we have the abdominal aorta. And with the abdominal aorta, you can always think of the, Triple H, the patient that have the abdominal aorta aneurysm, very common, something that we see in the ICU. All right. So at this time, since this right here is just a mock class that I'm redoing, what I did with the original class is they went around, there were about 12 students in the class, and we started in the back. And so then the one student told me that superior vena cava was the first thing the blood flows through. And then the next, student told me the next step, and we did blood flow all the way through the heart. And then occasionally I'd go out, I'd throw out a question here and there. Since obviously this is a mock class and I have no students right now, then we're not going to do that. But I got some feedback from the students, and they said that that was very helpful in remembering the blood flow through the heart. So. Okay, with that, so we covered the valves, the heart chambers, arteries, veins. One thing with veins as well, veins have valves in them. If you think about it, if blood flowing through the artery is very, very high pressure, it's lower pressure in the veins. So you have these valves to keep the blood going in the right direction. Okay. All right, any question there? No? Okay, what we're going to go on to now is talk about the electrical system. If you think about with your computer, you have all the mechanics and the hardware and everything else, but that means absolutely nothing. Means absolutely nothing unless you know, you have electricity behind it. So it's the same thing with the heart. Okay, so exactly the same thing with the heart. So we have, like, let's show the heart again. We've got the heart right here, okay, and we showed all the mechanics and everything. Okay, here's the atrium, the ventricles. Okay, what we have right here is called an SA node, and that we consider, in 70% of the people, it is the pacemaker of the heart. So what it does, it has electricity and it sends it out. We call that innervation, obviously, and it sends it out and it contracts the atrium. Okay, then we have an AV node, and this sends electricity to the AV node, but also there's a pressure response within the ventricles, which also has an effect on the AV node. Anyway, so then the AV node is going to send an electrical impulse out to the ventricles, and this causes the ventricles to contract. Okay, so we have the SA node, pacemaker, in about 70% of the people, and then we have the AV node, and the AV node is the key, plays a key role in contracting the ventricles. Okay. Now, one thing that you can know, that's important to know, is that the heart can randomly, and I don't fully understand this myself, but it can generate an impulse from here, or wherever. You know, it can, like, because of some kind of aberration, it may have a pacemaker, you know, elsewhere in the heart. But 70% of the people, it's actually the SA node. And one thing for you guys that already have some EKG experience, on the EKG, what are you going to see when the atrium contracts? So you're going to see that little P wave. Pause. So this right here is the atrium, and then this right here is the QRS, and that's the ventricles that are contracting. All right, so we talked about the pacemaker, the main pacemaker, and we also talked about the AV node, the innervation, and we just briefly discussed a little bit about the EKG. One thing that's important to note with the EKG is that it actually shows electrical impulses. So there's one rhythm out there that has electricity, but there is no pulse. And does anybody know what that is? Okay, so that's PEA, pulses electric activity. So if they don't have a pulse, I mean, it's treated just like asystole. Okay, but you will see that electrical activity on your EKG. All right, any questions there? Okay, so we talked about veins, and veins flow towards the heart, okay, and they contain deoxygenated blood except for one vein. We'll talk about that in a second. And then we have the arteries that flow, it's the blood flow away from the heart, and they contain oxygenated blood. And like I said, there's one exception to that, and do you remember me mentioning the pulmonary artery, because this is going away to the lungs, and then you have the pulmonary vein, okay? So obviously this is going to the lungs, so it's going to be deoxygenated blood, get rid of the carbon dioxide and picking up the oxygen, and then this is a artery. Oh, I said that backwards, didn't I? I'm confusing the heck out of you guys. Okay, arteries go away from the heart. So this is artery. This is the pulmonary artery. Okay, and it's going to the lungs. Veins go towards the heart. So this is going to be a vein because it's going towards the heart, and this is the pulmonary vein. Alright, so that's the only exception to the vein artery rule. Other than that, all other veins carry deoxygenated blood to the heart, and all other arteries carry oxygenated blood away from the heart. Right. We also talked about the heart chambers, the right and left atria, the ventricle. When you're talking about blood pressure, like you have, your systolic over your diastolic, well, your systolic is the pressure with ventricular contraction, and then diastole is ventricular refilling. It's also atrial contraction, because you have your atria contract, and then your ventricles contract, and then your ventricles relax, and then your atrium contracts again. So you have that loved up, loved up, loved up. Okay? Any questions there? One quick note is that 30%, like when you're with atrial contraction, 30% of your cardiac output is affected by this, so they consider this a atrial kick. So somebody that's in AFib, so AFib is the atrium that are just like quivering, okay? So they're not, it's either too rapid of a contraction or it's quivering. So you have aflutter and AFib, aflutter and AFib. So this accounts for approximately 30% of your cardiac output. So when you have somebody in AFib or aflutter, then they lose 30% to approximately 30% of cardiac output. So that's very significant, especially in a patient that's already compromised for other reasons. Okay, any questions on this? Okay. So right now I have actually during class yesterday, during the real class, then I went ahead and played this electrical system. It's just a videotape, and the lady talks you through it. I'm not going to do it just so that I can kind of go on and get a little bit more of my class on the videotape. It's a little bit on the boring side, but it helps you remember. It's a visual aid. Okay, so cardiac circulation, we've already covered this. It goes from the superior vena cava to the right atrium, through the tricuspid valve, right ventricle, pulmonary artery, left atrium, mitral valve, right ventricle, aortic valve, and then the aorta. So now I have a song for you, a really cute song. It's just kind of another visual aid that helps you remember it. And it goes really, really fast. So I wanted to make sure that you had the flow of circulation through the heart down before we actually watch this. But I will go ahead and play it for you. Okay, well, I played it yesterday and it was just fine. For some reason today it's not coming up. My mouse isn't showing up. But, oh, I may need an external mouse because I didn't set that up. Okay, so the circular song is something I pulled off of YouTube, and it's really cute, and it's kind of got a funky rhythm and beat, and so, everybody loves it, and it goes all the way through the, oh, here we go. We'll give this just a second to come up. While this is coming up, are there any questions whatsoever as far as circulation or anything we've covered up to this point? Alright, so of course this is a mock class because we had problems with the saving the video recording yesterday, but it was, a lot of students really enjoyed it, and one of them was like, oh, I'm going to have that tune in my head all day long, and so it was a good response. Okay. So with that, now we're going to go on. Okay, so we're going to talk about normal heart sounds. Obviously you want to know what the normal heart sounds are so that you're able to identify, something different, abnormal. The three things that we're going to cover are S3, S4, and then just briefly talk about murmurs. I also have a video clip for you that covers the S3, well, it tells you the normal, the lub-dub, and then you can actually hear the S3, the S4, and then you'll hear a couple of different murmurs. For the video presentation, we're not going to have time for the videotape. But, okay, so we'll go on to S1. So S1 is the lub. So if you think about when you're listening to the heartbeat, if there's a lub-dub and then a pause, lub-dub, pause. Our guy's a little bradycardic. Lub-dub, 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 okay? So that lub is the ventricular systole or contraction, and it's loudest heard in the mitral area. And this would be, put your stethoscope at the apex. So remember the apex is down here. So here's where your stethoscope is going to go, okay? At the apex of the heart. And that's to hear the lub. Okay? And what you're actually listening to is the tricuspid and the mitral valves closing. Okay, the next thing is the S2, and this is the dub, lub-dub, lub-dub. And this is ventricular diastole. And loudest is heard at the aortic area, and you're going to put your stethoscope at the base of the heart. Okay? So, right there. And what you're listening to is the aortic and the pulmonary valves are closing. And remember, I don't know if I reviewed this, but the whole reason that we have the different cardiac valves is so that blood doesn't flow back into a certain area. So, for example, with the tricuspid valve, you have they're going to be open when the atria are contracting, right? And then, same with the mitral valve. And then when the ventricles contract, then these are going to close off, okay? So that way you don't have, blood flow back into the atrium. That would not be good. So that's what you hear on the S1 and the S2. S1 is the tricuspid mitral valves closing. That's that lub, and then that dub on the S2 is the aortic and the pulmonary valves that are closing. Okay, any questions there? Okay. Next we have the S3 and the S4, and these are considered abnormal heart sounds. It's just a little additional click or a dub, okay? So with the S3, it goes in orders, 1, 2, 3, pause, okay? So you have lub dub, dub, pause, lub dub, dub, pause, okay? We often refer to this as Kentucky, Kentucky. Kin, tuck is the lub dub, and key is the additional one, and then you have the pause. Okay, the timer's done. Okay, and then with the S4, we call this the atrial gallop, and this is Tennessee. So actually, you hear it right before the lub dub. So it's kind of like S4, S1, S2, pause. S4, S1, S2, pause. And we say like Tennessee, like 10. That's going to be your little additional sound, and Nessie is the lub dub. Tennessee, Tennessee, Tennessee. Okay? So it's that la dub. Pause. So S3 is heard at the end. S1, S2, S3, pause. S4 is heard at the beginning. S4, S1, S2, pause. Okay. And with that, that's 30 minutes of my video presentation, so I'm going to go ahead and stop this. And that's it. Just eager for some feedback. Thank you.